What's going on, world? Welcome. Hey, y'all already know what today is. Today is Friday. So y'all know that y'all know what we're doing on Friday, right? We are doing NCLEX questions. Y'all already know we do NCLEX questions on Monday, Wednesday, Friday at 5:30. As you guys start to roll in here, you guys already know what's up. I want to know who you are, where you're from, where you're at in your nursing journey. I want y'all to smash that like button. I want for y'all to share, and I want for y'all to follow. Don't be greedy. Don't be greedy your whole life, all right? Don't be greedy, all right? Give me them likes. Give them to me. You know what I'm saying? If you guys are new here, like I said, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, I need 1,000 people. I need 100 people in here, and I need 1,000 likes. If I don't get none of them, y'all don't get no questions. How about that? What's up, Tay? Miss Ashley, how are you? Welcome. Hey, as you guys start to trickle in, I had just walked back into my office, so I have to get some things ready. But yeah. Like I said, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, by the way, shout out to my Miss Lady Stacy. She has most definitely made an impact on a lot of people that have, who are scared to talk about their NCLEX or them failing, so on and so forth. I'm telling you right now, y'all. Y'all failing y'all's NCLEX. That's the only problem. I'm telling you, that's your only problem. I think that's okay. You know what I'm saying? Other people coming out here running their mouth talking about, oh, you failed your NCLEX. I wouldn't hire you as a nurse. Well, it's a good fucking thing that you don't make decisions. Am I right? So I'm just letting y'all know. Don't be rude to people. Hey, everybody has some shit going on. Everybody has stuff going on. And realize where you are, where you were, and where you're trying to go. Don't be coming at people with shade. Don't be coming at people with stupidness. Because best believe, you come onto my shit and play, I'm going to play with you. Pause. You already know what the deal is. You know what I'm saying? It says Florida, MedSurg. Shout out to y'all. Hey, I need 1,000 likes. What are we doing? I need 1,000 likes. Make it happen. You already know what the deal is, y'all. We're doing NCLEX questions. I finally figured out what my whole lighting issue was. I finally figured that out. All right, here we go, y'all. Appreciate y'all being patient. Shout out to Kentucky. All right, y'all. Like I said, we're doing NCLEX question Monday, Wednesday, Friday. I think we got enough. Well, y'all keep smashing that like button. Now we're on the roll, on the road to 10,000 likes. Make it happen. Here we go. And ladies and Judgment Day is Saturday. Nah, that ain't Judgment Day. Here we go. Hey, and if these questions look familiar, hey, they look familiar, okay? Just kind of get over it and answer the question. I didn't ask you if they look familiar, right? Here we go. Answer question number 1. A patient in the cardiac unit is concerned about the risk factors associated with atherosclerosis. Which of the following are hereditary risk factors for developing atherosclerosis? Is a family history of heart disease, overweight, smoking, or age? What are we thinking? You can't see the question? Open your eyes then, Tay. What do you mean? I'm just kidding. Can you see it now? I think everybody can see it now. Everybody's screaming A. All right, I'll give y'all about 10 more seconds. Hey, we're going to fly through these today. They are open. Oh, okay, I got you, Tay. I got you. All right, we got a bunch of folks saying A. Got one that says D. Okay. All right. Man, so easy. Didn't ask you if it was easy. I asked you to answer the question. Come on. All right, y'all, here we go. Here's our answer in 3, 2, and oops, I lied. And the answer is A. Hold on one second, y'all. Here we go. So yeah, the answer is A. Family history of heart disease is a hereditary risk factor that is not subject to a lifestyle change. Having a first-degree relative with heart disease has been shown to significantly increase risk. That's part of health promotions and maintenance. 6 to 12% on the NCLEX, ladies and gentlemen. Make sure you guys understand you need content, Q&A, rationales. That is the way that you need to do these questions. So shout out to y'all. Keyword, hereditary, right? Here we go. Question number 2. Claudication is a well-known effect of peripheral vascular disease. Which of the following factors about claudication is correct? Select all that apply, which means I need more than one answer, right? I need more than one answer. It results when oxygen demand is greater than oxygen supply. It is characterized by pain that often occurs during rest. It is a result of tissue hypoxia. It is characterized by cramping and weakness. It always affects the upper extremities. What are we thinking? There we go. I'll give y'all some time. I'll give y'all 30 seconds. Give me some answers. If you guys are new here, welcome. We're doing NCLEX questions. These are both for RNs and LPNs. I got these off nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. I'm not asking you if you think these questions are easy. I'm asking you to answer them. All right. So once again, your opinion is irrelevant in that field. And just answer the damn question. You know what I'm saying? You know what I'm saying? Miss Watt, I see you out there. Ma'am, I still got you. Don't you worry about that. What's up, Kate? Kate, you already know the deal. You already know what you need to do. Make it happen. All right, y'all. Here we go. Here's our answer in 3, 2. And the answer is A, C, and D. Claudication describes the pain experienced by a client with a peripheral vascular disease with oxygen demand in the leg muscles exceeds the oxygen supply. The tissue becomes hypoxic, causing cramping, weakness, and discomfort. All right. So that is part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Remember, management of care, pharmacology, and physiological adaptation make up almost half of the exam, 44 to 49%. So shout out to everybody that got that right. All right. Make sure y'all keep smashing that like button. Y'all share, y'all follow. Hey, if you're in school right now, there should be no reason why you shouldn't share this with somebody. What are you doing? Stop being greedy. Here we go. Question 3. A nurse is providing discharge information for a patient with peripheral vascular disease. Which of the following information should be included in the instruction? Is it A, walk barefoot whenever possible, use a heating pad to keep feet warm, avoid crossing legs, or using antibacterial ointment to treat skin lesions at risk of infection? What are we thinking? Melanin nurse says 2 C's. Ma'am, it's just 1 C. What are we talking about? Hey, if you guys are new here, welcome. Doing NCLEX questions. Make sure you guys like, share, follow. That's the trifecta that TikTok needs. That's what I need to get it out to folks. You know what I'm saying? And if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Little rule in here, don't rush me with these questions. If you rush me, I block you just because I'm petty. Also, I've been a nurse for 3.5 years. I've worked in OR, ICU, and as well as the PACU. Been in the Navy for 16 years. As a matter of fact, tomorrow is my last day in the Navy. So I will be officially free after that. But here we go, y'all, because I'm petty. You already know what's up. Here we go. Here's our answer in 3, 2. And the answer is C. The answer is C. 1 C, not 2 C's, ladies and gentlemen. Avoid crossing the legs. Patients with peripheral vascular disease should avoid crossing the legs because this can impede the blood flow. Simple as that. Health promotions and maintenance. Remember, when you guys are studying your questions, you guys need to have content, Q&A, rationales. Rationales help solidify and help you retain the information that you've learned from content as well as when you're doing Q&A. I appreciate everybody's support. Thanks. Here we go. Question number 4. A patient who has been diagnosed with Raynaud's disease complains of cold and stiffness in the fingers. Which of the following descriptions is most likely to fit the patient? An adolescent male, an elderly woman, a young woman, or an elderly man? What are we looking at? I passed my NCLEX 2 weeks ago. Thank you, boot nurse. Yes, Miss Lauren. Yes, Lord. Hey, I need all of y'all right now, all 300 plus of y'all, while y'all are answering the questions right now. I need for y'all to give Miss Lauren all the love and all the support. Tell you love her. I don't care what you tell her. Tell her something positive, but congratulations. Welcome to the greatest shit show on earth, known as being a nurse. I say that with all the love and respect. But hey, if you could give anybody, one piece of advice about studying for the NCLEX and how you conquered it, what would that be? All right, y'all. I'll give y'all 10 more seconds. You take yours on the 19th. All right, Ty, I see you. Hey, when you pass it, come back and tell me. I take my NCLEX next week. Congratulations, you did that. That's what I'm talking about. UWorld, it depends. Some people don't like UWorld. I didn't like UWorld. So here we go. Here's our answer in 3, 2. And the answer is C, a young woman. Raynaud's disease is most common in young women and is frequently associated with rheumatologic disorders such as lupus and rheumatoid arthritis. That is also part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. I think Archer's okay. Here's the thing. There's a lot of reviews that are out there that work for people. I personally did not like UWorld. I didn't like Hurst. Hurst just really didn't like me. I liked Mark K. I liked Archer. I liked Kaplan. There's other ones out there I didn't like either. So it all just depends on you as the person. It all just depends on you as the person, how you retain information, what other stuff that you have going on. So here we go. Question number 5. A 23-year-old patient in the 27th week of pregnancy has been hospitalized on a complete bed rest for 6 days. She experiences sudden shortness of breath accompanied by chest pain. Which of the following conditions is the most likely cause of her symptoms? Is it myocardial infarction due to a history of atherosclerosis? Is it a pulmonary embolism due to deep vein thrombosis, anxiety attacks due to worries about her baby's health, or congestive heart failure due to fluid overload? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. Make sure you guys keep smashing that like button, share, and follow. Hey, I'm telling you right now, if I get to question number 10 and I don't have 10,000 likes, I'm boycotting the rest of these. It says recruiter from Johns Hopkins, pass this and come work here. Ain't nobody trying to come over there. What's wrong with you? I mean, if you want to go over there, you can, but ain't nobody trying to go over there. What's wrong with you? So what are we thinking, y'all? What are we thinking? I don't be coming over here Monday, Wednesday, Fridays at 5:30. It says back from you kicking me out. Abby, I remember I kicked you out. Yeah, I'm glad you're here. I don't be giving y'all this knowledge on Monday, Wednesday, and Friday just for y'all not to give me love and likes and share. What the hell y'all think this is? Anyways, so the answer is B, pulmonary embolism due to deep vein thrombosis. In a hospitalized patient on prolonged bed rest, the most likely cause of sudden onset shortness of breath and chest pain is pulmonary embolism. That is also part of health promotions and maintenance. Health promotions and maintenance, 6 to 12%. On the NCLEX exam. Shout out to you, Ashley. I see you. Appreciate all the shares and all the follows, y'all. Hey, that's the trifecta that TikTok needs. That's what I need. Make it happen. Here we go. Hey, real quick. Anybody studying for the NCLEX right now, I got some test-taking tips to help you conquer the NCLEX. Because, ladies and gentlemen, you don't just pass. You conquer that shit because it's a journey, not a sprint. It's an endurance race. So, anybody interested in getting a free download, go check that out, thebootnurse.com/test. Or you guys can find those links in my bio. All right, so here we go. Question number 6. Thrombolytic therapy is frequently used in the treatment of suspected stroke. Which of the following is a significant complication associated with thrombolytic therapy? Is it air embolism, cerebral hemorrhage, expansion of the clot, or resolution of the clot? What are we thinking? Shout out to all 400 plus of y'all in here rocking with me. All right, I appreciate y'all. We're doing NCLEX questions both for RNs and LPNs. I got them off nurseslabs.com. If you don't want to listen to me run my mouth, then you can take your happy self over there and do it by yourself. Also, I want to know who you are, where you're from, and where you were at in your nursing journey. Abby says, bleeding. I conquered my NCLEX. Did you? Tell us about it. That's what I'm talking about. Shout out to you for conquering that NCLEX. You already know what the deal is. Currently trying to listen to the live with my 1-year-old. Hey, look. Hey, so by the way, those, if at any point in time, if you guys want to check my lives out, I upload all of my lives, well, at least a good bit of them, to my YouTube channel. YouTube channel is at the Boot Nurse. You guys can check that out. And they're anywhere from like an hour and a half to 2.5 hours long. So yeah, go over there and get you your knowledge. But the answer is B, cerebral hemorrhage. Cerebral hemorrhage is a significant risk when treating a stroke victim with thrombolytic therapy intended to dissolve a suspected clot. That is part of physiological adaptation, third largest section on the NCLEX, 11 to 17%. Think of acute, chronic, trauma. Those are the types of things that physiological adaptation deals with, pathophysiology types, stuff like that. I'm just hanging out here as a paramedic. That's okay. Hey, I want to know, who are you, where you're from, where you're at in your nursing journey. By the way, if you are not a nurse, what you doing here? Like, what you doing here hanging out with us? Like, what's your area of profession? All right, here we go. Question number 7. An infant is brought to the clinic by his mother, who has noticed that he holds his head in an unusual position and always faces to one side. Which of the following is the most likely explanation? Is it torticollis with shortening of the sternocleidomastoid muscle? Is it the synostosis with premature closure of the cranial suture? Is it a plagiocephaly with flattening on one side of the head? Or is it hydrocephalus with increased head size? What are we thinking? Hey, by the way, if I mispronounce something, sorry. Like, do I look like I'm 10 years old getting ready for a spelling bee and how to pronounce words? No. So just y'all are going to be out here working. Y'all ain't going to be saying none of these words. So stop playing. All right. What else are we thinking? Little Rock, Arkansas. Shout out to you. Yes, I did on NCLEX achievable. Hold on a second, y'all. Let's see. It says NCLEX is achievable. Take what? Take your remediation seriously and relax. There you go. There you go. All right, here we go, y'all. Here's our answer in 3, 2. And the answer is A, is torticollis, with shortening of the sternocleidomastoid muscle. In torticollis, the sternocleidomastoid muscle is contracted, limiting the range of motion of the neck and causing the chin to point to the opposite side. That is part of health promotions and maintenance, which is what? 6 to 12% on the NCLEX. Hey, remember, when you guys start going through these, I want you to say the same thing. I want you to be like, man, what section is this part of? Health promotions? Yeah, 6 to 12%. Say it. Say it. Wait, Amy? Who Amy what? Wait, Amy, what happened? What'd I miss? Amy said I conquered my NCLEX in 2010. Amy, ain't nobody asking about you. That was like a whole, eon ago. What's wrong with you? No, but shout out to you for being a nurse for a good amount of time, ma'am. Here we go. Question number 8. An adolescent brings a physician's note to school stating that he is not to participate in sports due to a diagnosis of Osgood-Schlatter's disease. Which of the following statements does the disease or about the disease is correct? The condition was caused by the student's competitive swimming schedule. The student will most likely require surgical intervention. The student experiences pain in the inferior aspect of the knee, or the student is trying to avoid participation in physical education. What are we thinking? Another little thing about me, ladies and gentlemen, is that I failed my NCLEX, y'all, 3 times. 1, 2, and 3. I failed my NCLEX 3 times. And let me tell you something. No part of me cares. No part of me cares about what you think about that. Because me failing that NCLEX doesn't determine what type of nurse that I became. And it won't determine what type of nurse you're going to become or what type of higher level profession that you are going to become. I don't give a shit if you fail that exam 15 times. Guess who's not going to ask you how many times you took that exam? Your patient. Or even the turds that you work with. And by that, I mean other nurses. But shout out to y'all. Y'all know I love it. But it's too expensive. Hey, so here's the thing. When you start talking about things being too expensive, you need to tell me, what is something worth? A lot of people will tell me things are too expensive, but you'll go out here and you'll buy frivolous stuff. There's a big difference on buying things and investing. Know the difference. Know the difference. All right, here we go. And the answer is C. The student experiences pain in the inferior aspect of the knee. Osgood-Schlatter disease occurs in adolescence in the rapid growth phase of the infrapatellar ligament, and the quadricep muscles pull at the tibial tubercle, causing pain and swelling in the inferior aspect of the knee. It is commonly caused by activity that requires repeated use of the quadricep, including track and soccer. That is also part of health promotions and maintenance. All right, 6 to 12% on the NCLEX. I appreciate everybody smashing that like button. Thank you all for the follows. You guessed. Hey, you guessed and you got it right. That means you got a 25% chance of getting it right if you completely don't know. Right, rather than it being a 0 and you just don't get an answer at all. So I'd rather you answer and guess. Here we go. Question number 9. The clinic nurse asked a 13-year-old female to bend forward at the waist with arms hanging freely. Which of the following assessments is the nurse most likely conducting? Is it spinal flexibility, leg length, disparity, hydrostatic, hypostatic, blood pressure, or scoliosis? What are we thinking? I know somebody's going to come in here and be like, oh my God, this is easy. If it was easy, why people give me wrong answers? And sometimes you will get, what's up, Victoria? I see you, girl. Sometimes these will be easy. Sometimes it will just be easy to you. All right, here we go. Here's our answer. Here is our answer, ladies and gentlemen, in 3, 2. And the answer is the easy D. Scoliosis. Who's telling me next? Hey, don't come in here and tell me what to do. Because guess what? I will take forever. Anyways, so, and of course, it's scoliosis. A check for scoliosis, a lateral deviation of the spine, is an important part of the routine adolescent examination. That is, okay. I see you, Juicy Justine. I appreciate you. What is it? A health promotions and maintenance, 6 to 12% on the NCLEX exam, ladies and gentlemen. 6 to 12%. Sometimes you can bring the things that you've learned in your youth and be like, oh, so that's what they were doing. All right. That's what they were doing. Here we go. Question number 10. A clinic nurse interviews a parent who is suspected of abusing her child. Which of the following characteristics is the nurse less likely to find in an abusive parent? Is it low self-esteem, unemployment, self-blame for the injury to the child, or single status? What are we thinking? Shout out to all 900 plus of y'all. We're doing NCLEX questions. I got them off nurseslabs.com. which are free sets of questions. Like I said, both for RNs and LPNs. You guys can go over there and check them out. Keep smashing that like button. Keep sharing. Keep following. The more that y'all get carpal tunnel for me, I guess it's the more questions I'll give you. You know what I'm saying? And I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us? All right, y'all. Here we go. How often do I do these? Monday, Wednesday, Friday at 5:30. Here we go. Here's our answer in 3, 2. And the answer is C, self-blame for the injury to the child. The profile of a parent at risk of abusive behavior includes a tendency to blame the child or others for the sustained injury. For this injury sustained. Abusers typically blame others, especially their partner, for the mistakes in their lives. This is related to hypersensitivity, but they are not necessarily alike. This occurs because most abusive people don't hold themselves as being accountable for the actions they commit. That is part of psychological integrity, which is still 6 to 12% on the NCLEX. So just like abusers who don't hold themselves accountable, y'all don't hold yourselves accountable when you fail the NCLEX. Yeah, I said it. You want to know why? Because when I failed 3 times, guess who else didn't hold themselves accountable? Me, Kevin. So guess what? Hold yourselves accountable for what you do and you don't do. And then maybe you'll be able to pass that damn exam like I did. Stop playing with me. Hey, but I love y'all. I appreciate y'all being here. Hey, I got an ebook because guess what? The NCLEX, the path to conquering it begins with you. Just like I have for this ebook right here. Y'all can go over there. Y'all can check that out or go to that website right there. The ebook. Hey, there's over 700 pages, y'all. Over 700 pages of just nothing but just chocolatey goodness. And by that, I mean me. And by that, I mean my fanny pack because it's awesome. So shout out to that. Y'all need to go get it. All right. It says this is easy as EMT. Maybe. It all just depends. And like I said, these are free questions. But hey, the questions can get hard. Trust me, because these questions right here are a little bit easier than the ones that you find on NCLEX. But trust, NCLEX has anywhere from between they have like a 10,000 question bank. You know what I'm saying? Hey, I'm glad. My fanny pack is Gucci. You know what I'm saying? Question number 11. A nurse is assigned to the pediatric rheumatology clinic and is assessing a child who has been diagnosed with juvenile idiopathic arthritis. Which of the following statements about the disease is most accurate, right? The child has a poor chance of recovery within joint deformity. Most children progress to adult rheumatoid arthritis. NSAIDs are the first choice of treatment, or physical activity should be minimized. What are we thinking? What are we thinking, ladies? Everybody screaming C at me. I appreciate everybody that's here. Make sure you guys keep smashing that like button. You guys share, you guys follow. I do these every Monday, Wednesday, Friday at 5:30. Where I go over free sets of questions, free, FREE. And they're on nurseslabs.com. And trust me, even though people are saying these are easy, there's tons of people that come here and that say that thank you for these lives and they help. So whether you think it is easy or not, it's still here. It's still available. I wish I would have had something or knew of something like this when I was going through school. It probably would have made things a lot easier. But here we go. Jamie, you're welcome. Here we go, y'all. Here's our answer in 3, 2. This is a hard one. Because the other one was easy, right, Justine? But the answer is C. Non-steroidal anti-inflammatory drugs are the first choice in treatment. NSAIDs are an important first-line treatment for juvenile idiopathic arthritis. NSAIDs require 3 to 4 weeks for the therapeutic anti-inflammatory effects to be realized that are part of physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX, ladies and gentlemen, at 11 to 17%. I'm going to keep saying it until you know it. And then you're going to start working as a nurse. And be like, yeah. It's like 11 to 17% because that's what Kevin kept saying to me. So I'm just saying. All right, y'all, here we go. Question number 12. A child is admitted to the hospital several days after stepping on a sharp object that punctured her athletic shoe and entered the flesh of her foot. The physician is concerned about osteomyelitis and has ordered parenteral antibiotics. Which of the following actions is done immediately before the antibiotics is started? Is it the admission orders are written, blood cultures are drawn, a CBC with differential is drawn, or the parents arrive? What are we thinking? And I know other people are going to come in here and say, the same people that come in here and say that this is easy because it's a question are the same people that will, when they go and work as a nurse, won't do it. They'll be like, oh, damn, I can't believe I forgot about that. Yeah, but you saw it on paper, right? Don't forget where you come from. Don't forget where y'all came from. You see what I'm saying? Tess, you already know what's up. Mimi, y'all know what's up. Y'all need to stop playing with me. You know what I'm saying? People, hey, y'all, hey, look, I'm going to check you. And I don't got no problem doing it, but I love y'all. Here we go. Here's our answer in 3, 2. And the answer is B. I want to do a blood culture draw because antibiotics must be started after blood culture is drawn, as this may interfere with the identification of the causative organism, which is safety and infection control. 9 to 15% on the NCLEX. Like I need to know what nastiness is floating in your body. Because if I give you the wrong antibiotic and then the bacteria, or let's say it's viral and it's not bacterial, or vice versa. If I give you the wrong stuff, then what? Then the bacteria, if it's bacteria, they're just gonna be like, "Ooh, we like this. Let's adjust." You see what I'm saying? So who said I second guess myself? Jackie. Hey, y'all need to let her know. Jackie, we don't do that around here. We don't second guess. Hey, go with your first gut instinct because that's 9 times out of 10. That's the correct answer. Okay. Here we go. Question 13. A 2-year-old child has sustained an injury to the leg and refuses to walk. The nurse in the emergency department documents swelling of the lower affected leg. Which of the following does the nurse suspect is the cause of the child's symptoms? Is it a possible fracture of the tibia, bruising of the gastrocnemius muscle, possible fracture of the radius? No anatomic injury. The child wants his mom to carry him. What are we thinking? What are we thinking? All right, now think about it. Now, RTFQ, Victoria, I know you're in here. Let them know what RTFQ means. Let them know. Look at anatomy. Let them know. All right, I'm gonna give y'all 15. No, I'll give y'all 10 seconds. What is E? E ain't even on here. Read the F in question. Yeah. Oh, you already know what the deal is. Read it. Think of those key words that are in there. Things that help stand out. All right. Here we go. H is not on here. Here we go. And our answer in 3, 2. And the answer is A, possible fracture of the tibia, right? So the child's refusal to walk combined with swelling in the limbs is suspicious. Oh my God. It's just like suspicious for fractures. All right. That is physiological adaptation. 11 to 17%. 11 to 17%. On the NCLEX exam, okay? It's the third largest section. That's what you guys got to know. Content, Q&A with rationales. Hey, somebody said it's obvious, but hey, some people get their anatomy mixed up. And obviously, a lot of people got their anatomy mixed up and they got it wrong. What is RTFQ? RTFQ means read the F in question. Well, technically, that would be RTEQ. But you use your imagination. You tell me what the F word stands for. And it's exactly what you think it stands for. Question 14. A toddler has recently been diagnosed with cerebral palsy. Which of the following information should the nurse provide to the parent? Select all that apply. I'm not going to read them. Y'all can read them. And I'll give you 30 seconds right now. Hey, if you guys are new here, welcome. Hey, we're on the road to 30,000 likes. I don't know what happened to y'all. Did y'all get tired? I think y'all got tired. I hope not. Make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. Doing free sets of questions. And trust me, the questions can get much, much harder than this. He said, sorry, I'm cheating. Hey, if you ain't cheating, you ain't trying. I'm just playing. Don't. I'm like, don't do that. Don't do that. Don't do that. Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what you're doing here hanging out with us. I'm your gracious host, Kevin, BSN RN, I guess, if that's what you want me to tell you too. Been a nurse for 3.5 years. Worked in a burn ICU, a medical ICU, and I floated to a neuro ICU. Worked PACU as well as worked in the OR. So I've done a little things in the last 3.5 years. So shout out to Ghana. I see you. I want to become a nurse. Well, you need to put in the work in order to make that happen. So here we go, y'all. Here's our answer in 3, 2. And the answer is A, B, and D. Delayed development milestones are characteristics of cerebral palsy. So regular screening and intervention is essential. Because of injury to upper motor neurons, children have ocular and speech difficulties. Parent support groups help families to share and cope. Let me see what else. Physical therapy and other interventions can minimize the extent of the delay in developmental milestones. This was a long one. This is part of health promotions and maintenance, 6 to 12% on the NCLEX, ladies and gentlemen. Mango squeeze. Shout out to you, Miss Hawaii, Mr. or Mrs. Hawaiian nurse. So shout out to you. Dialysis. Shout out to you, Miss Jackie. All right, here we go, y'all. On to the next one. Y'all is doing good out here. A child has recently been diagnosed with DMD, right? Muscular dystrophy. The parents are receiving genetic counseling prior to planning another pregnancy. Which of the following statements includes the most accurate information? What are we thinking? This is all just going to be a bunch of gibberish. So y'all can read it. I'm from Sierra Leone. Oh, wow. Okay. I think that's a first. I don't think I've ever had anybody in here from Sierra Leone. So shout out to you. Welcome. I'm a phlebotomist. Good night. Is it Guyana, third year nursing. Shout out to you. Welcome, newbie nurses. You may be happy and successful. There you go. Loving your career. I'm Stacy from Milwaukee. All right. I'm new here. I just graduated on the 12th from the nurse. Shout out to you, Stacy. Shout out to you. I actually just had another Stacy. She just got her NCLEX. You should go check that video out if you haven't seen it. Hey, who has seen that NCLEX, that coaching video where she took it on her 12th attempt? You see what I'm saying? Hey, you're delayed, never denied. Delayed, never denied. Here we go, y'all. Here's our answer. Here's our answer. Shout out to Alabama. Michaela, I see you. Here we go. In 3, 2. It says, yes, where is Stacy? I can't find, I can't with, okay. Here we go. So, what is it? The Duchenne or whatever is an X-linked recessive disorder. Right. So the daughter has a 50% chance of being carriers and sons have 50% chance of developing the disease. Remember, that's number A. That's letter A. It's also part of health promotions and maintenance, 6 to 12% on the NCLEX exam. Jackie's just like, yes, there you go. Hey, shout out to everybody. Okay, Ashley, I see you out here getting these answers right. Appreciate you. Ladies and gentlemen, this is my NCLEX course, the 7-day NCLEX course. It's an NCLEX course I created because, like I said, I failed the NCLEX 3 times and I never wanted anybody to feel how I felt. So I'll go over tons of content. I actually have a new generation NCLEX review that's 4 hours long, separated into 8 videos that's inside of that course. You guys can check that out. It's pronounced Duchenne's. Okay, cool. I'm glad I read that. But anyways, so, but yeah, you guys can go over there. You guys can check that out. Check it out for yourself, bootnurse.com/special. And I have 60 videos that are in there right now. And I'm projected to have at least over 200 videos in there right now. Nothing but tons of content. And I'm actually about to start recording my cardiac section on top of getting the rest of the 7-day review in there as well. So y'all check that out. Do you cover new generation NCLEX they just put out? Yes, I do. So here we go. Question number 16. A client is scheduled for a percutaneous transluminal coronary angioplasty or PTCA. The nurse knows that a PTCA is what? Surgical repair of a diseased coronary artery, placement of an automatic internal cardiac defibrillator, a procedure that compresses plaque against the wall of a diseased coronary artery to improve blood flow, or is it a non-invasive radiographic examination of the heart? What are we thinking? What is that procedure? Name that procedure. Appreciate everybody being here. I got these questions off nurseslabs.com. They are free sets of questions, ladies and gentlemen. So if you don't like my voice or anything like that, or even like me, which I'm totally okay with that, y'all can go over there and do them by yourself. You don't have to come and see me every Monday, Wednesday, and Friday at 5:30. You see what I'm saying? See what I did there? So shout out to y'all. Hey, if you're new here also, it says the Mark Clemic video helped me the most when I took it in 2020. So the Mark Clemic videos, those are old. Not saying that they're not helpful, but they are old, like from between 2008 and 2010. So while they are still very helpful, I would agree. I actually went to his review in 2019 and it was phenomenal, exactly like the audios. Here we go. But the answer is C, the procedure that compresses plaque against the wall of the diseased coronary artery to improve blood flow. A PCTA is performed to improve coronary artery blood flow in a diseased artery. It is performed during a cardiac catheterization. Aortic coronary bypass graft is the surgical procedure to repair a diseased coronary artery that is part of risk of reduction of risk potential, which is 9 to 15% on the NCLEX, ladies and gentlemen. Hey, there are 8 sections of the client needs for the NCLEX. Everything else are subcategories that fall under there, and there are tons of them. But if you know what your 8 are, hey, you'll be able to rock it. You will be able to rock it. All right. It says, thank you for what you do for future nurses. Good luck, everyone. I love doing this. I truly enjoy doing this. I actually, active duty while I was in the Navy, I've been an instructor. I'm a master instructor in the Navy, and I have been for the last 9 years. So I enjoy teaching. But here we go. Question 17. A newborn has been diagnosed with hypothyroidism. In discussing the condition and treatment with the family, the nurse should emphasize what? They can expect the child will be mentally retarded. I don't know why. Administration of thyroid hormone will prevent problems. This rare problem is always hereditary. Physical growth and development will be delayed. What are we thinking? What are we thinking, ladies and gentlemen? Appreciate all the shares and all the likes and all the follows. They're greatly appreciated. I actually have hypothyroidism. This is funny. Well, that's cheating because you got it, and so you can't answer. What are you thinking right now? No, but please go ahead and answer. If you guys are new here, welcome. I appreciate you guys being here. We're doing NCLEX questions for both RNs and LPNs. Nurseslabs.com. You guys can go over there and check those questions out for yourself. But here we go. Here we go with our answer. Never go for an absolute. There you go. Right? That's right. That's how they catch you. But here we go. In 3, 2, and the answer is B. Administration of thyroid hormone will prevent problems. Right? Early identification and continued treatment of hormone replacement correct this condition. Physiological adaptation, which is the 3rd largest section on the NCLEX exam, 11 to 17%. 11 to 17%. Hey, management of care, physiological adaptation, and pharmacology make up 44 to 49% on the whole exam. That's almost half. Pay attention. Pay attention. Pay attention. I'm going to start talking like Dr. Umar. I'm going to start saying shit 3 times, so I'm going to make sure y'all hear me. All right, here we go. Question number 18. A priority goal of involuntary hospitalization of the severely mentally ill client is what? Reorientation to reality, elimination of symptoms, protection from harm to self and others, or return to independent functioning. What are we thinking? What are we thinking? I know a lot of people are just like, oh my God, these are easy. Remember, this is a review. I expect for you to know these answers if you've already gone through school and you're preparing for the exam. I expect for you to know a lot of these. You know what I'm saying? That's the whole point of a review. A lot of people go into these reviews and they're just like, I didn't learn anything. Well, shit, that means you didn't learn nothing in school. And I'm telling you that because that was me. I mean, I learned a lot in school, but that was me. So you can't put the responsibility on somebody who's trying to do stuff for you, trying to get you in the right direction. All right. And if you haven't started school, best believe you're going to be there one day. All right. Here we go. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. And our answer is C, protection from self-harm and harm to others. Involuntary hospitalization may be required for persons considered dangerous to self or others, or for individuals who are considered gravely disabled. That is part of psychological integrity. 6 to 12% on the NCLEX exam. 6 to 12% on the NCLEX. I'm barely done with my prereqs and I feel good with it. Yeah. So, hey, if you aren't anywhere near where you need to be in taking this exam, get the learning in now. Get the knowledge in now. What application am I using? PowerPoint. So here we go. Question number 19. A 19-year-old client is paralyzed in a car accident. Which statement used by the client would indicate to the nurse that the client was using the mechanism of suppression? I don't remember anything about what happened to me. I'd rather not talk about it right now. It's the other guy's fault. He was going too fast. My mother is heartbroken about this. What are we thinking? Appreciate everybody being in here, rocking with me. Hey, we're on the road to 30,000 likes. Hey, get carpal tunnel for me. Hey, if you don't get carpal tunnel for me, like right now, like NEOW, we're gonna have another conversation. All right. But I appreciate everybody being in here. Hey, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. Definitely a psych question. Not the carpal tunnel. Yeah, you already know what's up. Here we go, y'all. Here we go. Hey, remember, what is the biggest thing about psych? What is the biggest thing about psych that can help you answer those questions? Because remember, with psych, it's all about, I actually have carpal tunnel at 26. Maybe, ma'am, you should put the video game down and stop PC gaming or stop texting. You know what I'm saying? That's a contributing factor, right? You failed twice. That's cool. I failed 3 times. Welcome to the club. All right. But the question is, what are you going to do? What are you going to do to fix that? You're going to sit there and wallow in your sorrows, or are you going to get up and make something happen? Right? So, hey, remember from work. Oh, yeah, I bet. So remember, it's all about good therapeutic communication. Somebody said, look, it's psychosocial integrity, right? 6 to 12% on the NCLEX. I don't remember anything about what happened to me, right? Somebody said a defense mechanism. Remember, with psych, it is all about good therapeutic communication skills. Nessa says, dialysis nurse here, you guys do it. That's what I'm talking about. Let them know. Let them know. I'm nervous for the NCLEX. I've already accepted a job, so I got to pass. Hey, so here's the thing. You are going to be nervous when you take your exam, y'all. You're going to be scared. But two things. If you're scared, go to church. That's the first thing. Or whatever temple you go to of higher beings. Second thing is that you're gonna be scared, but you're gonna do it anyway. And that's me telling you to do that, because nobody ever got anything accomplished by saying, oh, I'm scared, I'm not gonna do it. You have to do things scared. You have to. If you're scared, go to church. That's what I'm trying to tell y'all. Here we go. Question 20. A nurse is caring for a woman 2 hours after a vaginal delivery. Documentation indicates that the membranes were ruptured for 36 hours prior to delivery. Which of the following nursing diagnosis at this time? So what's the priority nursing diagnosis? Is it altered tissue perfusion, risk for fluid volume deficit, high risk for hemorrhage, or risk of infection? What are we thinking? Shout out to all 480 y'all in here rocking with me. We're doing NCLEX questions. Everybody out here getting carpal tunnel for me. Everybody out here getting Hey, so everybody said, hey, so tell me why. You guys are telling me your answers, but tell me why. I want to know why real quick. I'm going to give y'all an additional 30 seconds. High risk of bleeding, right? So what tells you in this question, your reasoning for picking that answer? Infection can be high. Yes, C. Exposure. Okay. Because it's been over 36 hours. Okay. These are the things that you need to pay attention to. Key words, right? Key phrases, right? All of this is cool, but I need to know, this is probably the most important of the sentence. Like, what is the priority, right? But in order for me to understand what the priority is, I need to know what all this says in order for me to make an informed and good decision based off of what my answer choices are. All right. So here we go. Here's our answer in 3, 2, and the answer is A. I'm just playing. It's not A. Don't come for me. I'm just kidding. It is risk for infection, right? Membrane ruptured over 24 hours prior to birth greatly increases the risk of infection to both mother and the newborn. That is part of physiological adaptation, which is what? The third largest section on the NCLEX exam at what? 11 to 17%. Yes, it is. Yes, it is. So make sure you guys pay attention. RTFQ. Read the fucking question. Sorry, hey, if you don't like the F word, you're gonna have a hard time being a nurse, because y'all ladies got some swear words. Let me tell you. Here we go. Ladies and gentlemen, if y'all don't know this young lady right here, that is Stacy. She took her NCLEX and passed it on her 12th time. So I'm always going to give her a shout out, because she came to me when she failed and she wanted me to coach her. I coached her. She did all the work. I guided her. Let me tell you something right now. This one right here, she the one right here. She the one right here. I put a video down in my bio. Y'all go check that video out. It's about 6 minutes long. You know what I'm saying? This right here is perseverance. I don't give a shit what none of y'all say. Somebody came into my chat. They was like, oh my God, you're unsafe. Who gives a shit about a test? The test is just a way for you to get into the door. You learn how to be a nurse when you get there. You learn how to be a nurse when you start working. Hey, y'all need to stop playing with me. Y'all need to stop playing with me, because everybody's situation is different. All right. But shout out to Stacy. Anybody interested and need coaching and need help with NCLEX, you guys can check that link out in my bio. With experience, you see what I'm saying? Y'all can check that link out in my bio. But here we go. Question number 21. A 3-year-old had a hip spica cast applied 2 hours ago. In order to facilitate drying, the nurse should what? Expose the cast to air and turn the child frequently. Use a heat lamp to reduce the drying time. Handle the cast with an abductor bar, or turn the child as little as possible. What are we thinking? It says facts. I'm an orthopedic and spine nurse and learned about everything when I started working. Exactly. Some of these people come in here on such a fucking high horse as like, oh my God, I only took it once. Bitch, ain't nobody ask you. Ain't nobody ask you about you. Okay? Because this ain't your channel. This ain't your page. Go away. This ain't about you. This is about her. Either give her props or go the fuck away. What you mean, bro? Shit. Hey, if y'all are finding value in what I'm talking about, smash that like button and be my friend, bro. Like, stop playing with me. You know what I'm saying? Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is A, expose the cast to air and turn the child frequently. The child should be turned every 2 hours when the surface exposed, with the surface exposed to the air. Cast and splints hold the bones in place while they heal. They also reduce pain, swelling, and muscle spasms. That is part of pharmacological and parenteral therapies. Why? I honestly don't agree with that setting, but there's something about it that's putting it in that category. But, I actually would put it under physiological adaptation, but hey, what do I know? But hey, just remember, there are tons of different categories and subcategories under the client needs. So be aware of that. When you guys are studying, pay attention to those. I don't care if you're using Archer. I don't care if you're using UWorld. I don't care if you're using Hearst. I do care if you're using the 7-day NCLEX course because that's mine and I want y'all to go get that. But, same. All right. Pay attention to those. All right. Here we go. Question 22. A client is scheduled for a IPV. In order to prepare the client for this test, the nurse would instruct the client to maintain a regular diet the day prior to the examination, restrict the client's fluid intake 4 hours prior to the examination, administer a laxative to the client the evening before the examination. That sounds fun. Inform the client that only one x-ray of his abdomen is necessary. What are we thinking? Shout out to all 500 plus y'all in here rocking with me. We're doing NCLEX questions. I got them off nurseslabs.com. Nurseslabs.com. Free sets of questions. You guys can go over there and check them out for yourself when you guys are ready. Also, make sure you guys keep smashing that like button. Make sure you guys keep sharing. You guys keep following. Hey, we're on the road to 40,000 likes. I just want to let y'all know that the most likes I've ever had is 118,000 likes. To be honest, I kind of want to get back there. You know what I'm saying? So don't be greedy. Hey, if you're in school right now and you haven't shared this with your cohort, I don't give a damn how you feel about them. Share it to them. Don't be greedy. All right. Share it to them. Knowledge is power, But I appreciate everybody being here. If you're new here, I want to know who you are, where you're from, and where you were at in your nursing journey. If you're not a nurse, what you doing here hanging out with us. But the answer is C. The answer is C. Administer a laxative to the client the evening before the exam. Now, a lot of people are just like, oh my God, why? This is why you read your rationales. Sandusky, Ohio? Man, I got a lot of y'all from Ohio, But here we go. Bowel prep is important because it allows greater visualization of the bladder and ureters. IPV is an X-ray exam that uses an injection of contrast material to evaluate the kidneys, ureters, and bladder and helps diagnose blood in the urine or pain in the side or lower back. An IPV or an IVP, I'm sorry, I'm saying it wrong, but an IVP may provide enough information to allow the doctor to treat with medication and avoid surgery. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 14 to 18%. 14 to 18%. MIA nursing student, like you're missing in action? Cynthia? Oh, Cynthia, what you mean you missing? I see you right there, girl. So shout out to everybody that got that question right. Here we go. Question number 23. Following a diagnosis of acute glomerulonephritis. Hey, I want y'all to try to say that like 10 times fast. In their 6-year-old child, the parent remarks, "We just don't know how he caught this disease." The nurse's response is based on understanding that what? AGN is a streptococcal infection that involves the kidney tubules. The disease is easily transmittable in schools and camps. The illness is usually associated with chronic respiratory infection. It is not caught, but is in a response to a previous B hemolytic strep infection. What are we thinking? Registered nurse from Gambia. Shout out to you, Miss Gambia. I see you out there, Miss Lady. What are y'all thinking? South Dakota, I've been there. Mom for nurse. I've been there. I went to Rapid City. I enjoyed that. I enjoyed that a lot, actually. A lot more than I actually thought I would. Not right now, though, because it's cold as hell. But if you guys are new here, welcome. Hey, make sure y'all keep smashing that like button. Make sure you guys share. Make sure you guys follow. Who said something? San Antonio? I see you, Nessa. I live in San Antonio. Shout out to all my Texas folk out there. You know what I'm saying? Shout out to all my Texas folk. Vanessa, what hospital are you trying to work at? The only one that better come out of your mouth is university or the VA. Texas gang, y'all know what's up. Let me read it again. You better hurry up. You got 5 seconds. In 3, 2, 1. I'm at Methodist. Which one, Vanessa? Here we go. No, don't tell me which one. I don't need people coming for you like that. Shout out to H-Town. But the answer is D. It is not caught, but is in a response to a B hemolytic strep infection. AGN is generally associated as an immune complex disease in relation to an antecedent streptococcal infection of 4 to 6 weeks prior and is considered a non-infectious renal disease. That is part of physiological adaptation. Physiological adaptation, ladies and gentlemen. All right, 11 to 17%. 11 to 17%, which is the third largest section on the NCLEX. I call them the big three: management of care, pharmacological and parenteral therapies, and then you have physiological adaptation. Those three, 44 to 49% of the entire NCLEX, okay? So trust and believe me, you're going to see some questions just like that. You know what I mean? Here we go. Question 24. The nurse is caring for a 20-pound, 6-month-old with a 3-day history of diarrhea, occasional vomiting, and fever. Peripheral intravenous therapy has been initiated with 5% dextrose, with 0.33% normal saline, with 20 milliequivalents of potassium per liter, infusing at 35 mLs per hour. Which finding should be reported to the healthcare provider immediately? AKA, what is wrong? What is the most pertinent thing that I need to be like, doctor, help me? Right? Is it 3 episodes of vomiting in an hour, periodic crying and irritability, vigorous sucking of a pacifier, or no measurable voiding in 4 hours? Right? So, hey, remember, this is what the NCLEX wants, ladies and gentlemen. They want you to utilize analysis and application with critical thinking in order for you to make a clinical judgment. You can go to the ncsbn.org website, look at the 2023 NCLEX test plan, and that is exactly what it says. Critical thinking in applying that to make a clinical judgment, right? That's why they changed the NCLEX. So that is what I need for you to apply the critical thinking that you learn in school and pick you an answer. Pick you an answer. And make sure it's a clinical judgment, right? No measurable voiding in 4 hours. Who said it down there? Somebody said something about kidney function, right? Kidney function. The concern is possible hyperkalemia, right? Which could occur with continued potassium administration and a decrease in urine output, since potassium is excreted via the kidneys. Successful management of acute hyperkalemia involves protecting the heart from arrhythmias with the administration of calcium, shifting potassium into the cells, and enhancing the elimination of K from the body. That is physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Right? So if I'm not having any urinary output in 4 hours, that means all my potassium is just wanting to hang out and be like, hey, heart, let me fuck with you a little bit. Right? Why would I want to I don't want to keep continuing to give somebody more potassium so they could just be like, hey, what up, bro? Let's fuck with the heart a little bit. No. We don't want that. We want to get rid of that. We got to get it out of the intravascular space, right? We got to get it out, because all it's going to do is just, fuck with the heart a little bit. So appreciate everybody. I'm glad everybody got that answer right. Let's move on to the next one. Here we go. Question number 25. While caring for the client during the first hour after delivery, the nurse determines that the uterus is boggy and there is vaginal bleeding. What should be the nurse's first action? Check vital signs, massage the fundus, offer a bedpan, check for perineal lacerations. What are we thinking? Victoria, are we friends now? Got a friendship bracelet? That's what I'm talking about, girl. I appreciate you. Ashley says B. Ashley, you ain't got to yell at me, girl. I see you. I see your answer. Shout out to all 500 plus of y'all in here rocking with me. We're doing NCLEX questions. Got them off nurseslabs.com. Hey, I do these questions every Monday, Wednesday, Friday. 5:30 Central Standard Time, Texas time, because that's the only time that matters. Wendy, I have not sent it to you yet because I got home late. Ended up getting on a phone call, and then I just didn't have the time. But I'm going to do that afterwards. So we're still good. I ain't forget about you. Vitals are vital. I see what you did there. Okay. All right, y'all, here we go. Here's our answer. Hey, remember, you got to read the question. All right, here we go. Here's our answer in 3, 2, and that is not it. Where's my answer? Did I do it wrong? Oh, hell, I forgot my answer. But it is massage the fundus. It's massage the fundus, y'all. Sorry. It's the fundus. The answer is the fundus. I don't know where it's at. I don't know what happened to it. I'm sorry. But anyways, hey, real quick, ladies and gentlemen. Hey, a lot of people ask me, can I do group coaching to help prepare them for the NCLEX? And right now I have developed a waiting list to do coaching for at least 10 people, but I had to push that back, and it's probably going to happen sometime earlier in the spring, like probably March timeframe. So anybody interested in being a part of that, you guys go check that link out right there, thebootnurse.com/waitlist. And once I get everything taken care of, I'm going to be sending an email out to that wait list and that wait list alone. All right. And once it's there. First 10 people to jump on it. You guys will be a part of it. And then we're going to make some magic happen. We're going to make some magic happen. It's going to be 30 days. There's no weekend. There's no weekend type of review. It's going to be 30 days where 10 people are going to be working with me to help y'all conquer the NCLEX, whether it be your 11th or 12th time, or if it's your first time. I don't care. I don't care which one it is. All right. So make sure you guys, if you're interested in that, you guys go over there and check that out. That link is also in my bio. But here we go. Question 26. The nurse is assessing an infant with developmental dyspnea dysplasia of the hip. Which finding would the nurse anticipate? Is it unequal leg length, limited adduction, diminished femoral pulses, or symmetrical gluteal folds? What are we thinking? Shout out to everybody that is still here rocking with me. Y'all got me to 35,000 likes. I appreciate y'all. 500 plus people in here. Bro, this is easy. I didn't ask you if it was easy. I said answer the question. That's what I said, you know what I'm saying? And if it was easy, why are people giving me the wrong answer? See what I'm saying? Come on, guy. Come on. Yeah. So here we go. I'll give y'all 5 more seconds. We'll see what's up. All right, here we go. Here's our answer in 3, 2, and the answer is A. Unequal leg length. Shortening of a leg is a sign of developmental dysplasia of the hip. The hip is a ball and socket joint. In a normal hip, the ball of the upper end of the thigh bone fits firmly into the socket, which is part of the large pelvic bone. In babies and children with developmental dysplasia or dislocation of the hip joint has not formed normally. The ball is loose in the socket and may be easy to dislocate. That is part of physiological adaptation. Physiological adaptation, which is the third largest section on the. I should have read the whole question. No, you should have read the fucking question. But yeah, there you go, Victoria. Yeah, that's what you should have did. But that's okay. We all live and we learn, right? Third largest section on the NCLEX, 11 to 17%. All right, here we go. Shout out to everybody that got that one right. Question 27. To prevent a Valsalva maneuver in a client recovering from an acute myocardial infarction, the nurse would what? All right, paint the picture. You're in the trauma bay, right? Somebody's having an acute MI, right? We're trying to prevent the Valsalva maneuver, right? So what do I want to do? Assist the client to use the bedside commode, right? Administer stool softeners every day as ordered. Administer anti-dysrhythmics PRN as ordered, or maintain the client on a strict bed rest. What are we thinking? Prevent straining. Well, of course you're not going to give stool softeners in the trauma bay. I mean, you would, if you're going to send them home, hey, take these stool softeners. Anytime I see somebody that has an acute MI, I always think about the trauma bay. But then again, I've worked ICU and we've had people have MIs up there too. So, but thank you for being technical, because I forgot. Okay. All right, here we go. Shout out to all 600 plus of y'all. We're doing NCLEX questions both for RNs and LPNs. Got them off nurseslabs.com. You guys are, no, you're good. Is it Julia? You're good, Julia. You're good. Here we go. Here's our answer in 3, 2. And the answer is we don't give stool softeners in the trauma. No, I'm just playing. Administer stool softeners every day as ordered. Administering stool softeners every day will prevent straining of defecation, which causes the Valsalva maneuver, right? If constipation occurs, then laxatives would be necessary. Necessary to prevent straining. That is part of pharmacological and parenteral therapies, which is what? The second largest section on the NCLEX at what? 14 to 18%, or there's other places where it says 13 to 19%, but it still doesn't negate the fact that it is still the second largest section in the NCLEX exam and part of their test plan, okay? So be aware of that. Here we go. Question number 28. On admission to the psychiatric unit, the client is trembling and appears fearful. The nurse's initial, keyword, initial right? What is a nurse's initial response should be, right? Give the client orientation material and review the unit rules and regulations. Introduce him or her and accompany the client to the client's room. Take the client to the day room and introduce her to other clients or him. Or ask the nursing assistant to get the client's vital signs and complete the admission search. All right, what are we thinking? Shout out to all y'all out here rocking with me. Hey, 40,000 likes, y'all. Hey, less than 5,000. Make it happen. Get carpal tunnel for me, except for the young lady who got carpal tunnel from work. You're exempt. I appreciate y'all rocking with me. I want to know who you are, where you're from, where you're at in your nursing journey. Trying to foster a good little community down here in the chat. You know what I'm saying? ELE, everybody love everybody. All right. So I'm going to give y'all 10 more seconds. Taking NCLEX Dune? Yeah, me too. I'm guessing you meant soon. I got you. Candy girl, you are my... All right, I'm done. But hey, shout out to you. But here we go. Here's our answer, y'all. Here's our answer. VA nurse, shout out to you, Josh. Hey, anybody work for the VA? Y'all my people, man. I love y'all. Here we go. And our answer is B. Introduce him or her and accompany the client to the client's room. Anxiety is triggered by change that threatens the individual's sense of security. In response to anxiety in clients, the nurse should remain calm, minimize stimuli, and move the client to a calmer, more secure/safe setting. That actually is part of management of care, right? Because I don't want to I can't delegate that to my nursing assistant, right? Shout out to who gave me hearts. Yes, Lord. There we go. I appreciate you. Is it Nurse D? Thank you for the heart. But so management of care, which is 18 to 23% on the NCLEX. 18 to 23%, the largest section on the NCLEX exam. All right. I could be off by a couple, but still doesn't take away the fact that it is still the largest section on the NCLEX. Julia, thank you for the heart. Appreciate you. Here we go. Question number 29. During the admission assessment of a client with chronic bilateral glaucoma, which statement by the client would the nurse anticipate since it is associated with the problem? I have constant blurred vision. I can't see on my left side. I have to turn my head to see my room. I have specks floating in my eyes. The largest section is management of care. Philly nurse. Hey, shout out to Philly. Philly Steak and Cheese. Kevin Hart. Meek Mill. The Philadelphia Eagles. I think that's all I know. I'm sorry. That's all I got. What are we thinking, y'all? What are we thinking? One more year. Hey, it'll fly by before you know it. Before you even know it. Y'all got me to 40,000 likes. I appreciate y'all. Floors and design, the angle closure. Got you. Here we go, y'all. 5 seconds. Here's our answer. Here is our answer in 3, 2, 1 more semester. I know that's right. Here we go. And the answer is C. I have to turn my head to see my room. Intraocular pressure becomes elevated, which slowly produces a progressive loss of peripheral visual field in the affected eye, along with rainbow halos around light. Intraocular pressure becomes, elevated from the microscopic obstruction of the trabecular meshwork. If left untreated or undetected, blindness results in the affected eye. That is part of physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. 11 to 17%. Is that treated with mannitol for intracranial pressure? I mean, possibly, but mannitol is for intracranial pressure. NCLEX in 12 days got that question wrong. That's okay. That's okay. This is what this is for. It's to help you learn. Graduated with BSN in December. Get ready for NCLEX. That's what I'm talking about. Mare Rose. That's ICP. Insane Clown Posse. Anyways, here we go. Question number 30. A client with asthma has low-pitched wheezes present in the final half of exhalation. 1 hour later, the client has high-pitched wheezes extended throughout exhalation. This change in assessment indicates to the nurse that the client is what? Has increased airway obstruction, has improved airway obstruction, needs to be suction, or exhibits hyperventilation. What are we thinking? Obviously, we see that this is an airway issue, right? So what are we thinking? Shout out to all 600 plus of you guys in here rocking with me. Shout out to y'all. Shout out to y'all. What are we thinking? I'll give you guys 15 seconds. Somebody said got worse. Everybody's screaming A. What sound does that letter make? Tell me. Somebody told me D. Okay. Got A. Yep, worse. Okay. C. Okay. A. Increased bronchial constriction. Look at you, smarty pants. What's your smarty pants answer, Miss Julia? All right. Hit. Wait, it says, okay. All right, here we go, y'all. Let's see what the answer is. Let us see what the answer is in 3, 2. And the answer is A. He has increased airway obstruction. The higher pitched a sound is, the more narrow the airway. Therefore, the obstruction has increased or worsened. With no evidence of secretion, no support exhibits to indicate the need for suctioning. That is part of physiological adaptation, which is 11 to 17% on the NCLEX exam, ladies and gentlemen. Third largest section, 11 to 17%. Know it, live it, love it. Hey, I'm telling you right now, the way, and look, nursing is 90% women, all right? The way that you focus on, being a baddie out here, or the way that you focus on your man, thank you to your man, the way that y'all focus on all that stuff, that's how you need to be focused on NCLEX. See, look, sometimes I got to come and I got to talk to y'all, and I got to let y'all know what the deal is. You know what I'm saying? This is how you have to focus. NCLEX needs to be your life because it's only temporary. All right. I don't want to hear nobody come up to me and saying, thank you to my man. I want to be like, hey, thank that ass to that book and start studying for NCLEX. Stop playing with me. All right, here we go. All right. Hey, ladies and gentlemen, that is it for our questions today on this Friday. I want to thank you guys for being a part of that. Hey, I'm going to do an Ask Me Anything after this. I'm going to turn this camera around so you guys can see my disgustingly hitty face, right? So, but I appreciate all the love, all the likes. Y'all got me to 43,000 likes. I couldn't be more appreciative of that. Hey, I didn't have to ban anybody. I'm really sad about that because I like banning people. It really is therapeutic for me. So if you come to me stupid, I'm going to come at you stupid. Anyways, I don't gatekeep. I got these questions at nurseslabs.com. All right. Make sure you guys go over there and check that out. Anybody interested in the 7-day NCLEX course, you get it for a lifetime and you get all the updates. So if you're in nursing school right now, one of the biggest flexes you could ever have is getting an NCLEX course for less than $100 and then getting all the updates. So I'm just saying, and there's already a review that's in there as well as content. It's got free stuff, got tutoring, coaching, ebook, all that good jazz. You guys go over there and check that out. Okay. It says, thank you. Take my NCLEX next month. All right, cool. Now what I'm going to do is, what's up, y'all? How y'all doing? Hey, my eyes is looking kind of puffy right now just because I got these allergies going on. You already know. If you live in San Antonio, you already know what the deal is. So notifications are on. Hey, turn them on. Turn them on. Stop playing with me. It says, thank you, Kevin, so much from Sierra Leone. Yes, ma'am. Thank you for coming. Hey, so a little bit about me. If you guys have never been here, my name is Kevin. I have been Kevin Hart, but taller. Oh, my God, you Kevin Hart, but taller. Yeah, I am actually taller than him now I think about it. Shout out to Zambia. Been a nurse for 3.5 years. Worked OR, ICU, and worked PACU. Love it, love it. PACU is by far my most favorite. I've been in the Navy for 16 years. You're welcome. You're welcome. Been in the Navy for 16 years. I've been a nurse for 3.5. I'm an instructor. Says Kevin, take a sip of water. I ain't got no water in here. I already drank it. Thank you, Julia. Appreciate you. Yeah, I've been an instructor. I was a surgical technology instructor for 3.5 years. I've taught a trauma nurse core course, pre-hospital trauma, ACLS, ABLS. I've taught a whole bunch of stuff. So thank you for your, I appreciate your support. Thank you. Kevin, when you teach this class, do you talk about test taking strategies? So when I take these, so TikTok, Miss Barbara. So if you guys don't know Miss Barbara is she's done things longer than I've been alive. So, but Miss Barbara, I don't talk about test taking strategy. I mean, I do, but I don't. I don't really dive so much into it because TikTok is so fast. Like people's attention span is just like, he's talking about what I don't want to know. Got to go. So I try to just stick to the questions. And then as I go along, if I see something that sticks out, hey, I kind of expand on that. Bro, I had a colonoscopy and thought of you today. My man, you had butt stuff going on? That's crazy. Victoria, I appreciate you. Do you like life as... I love teaching. Grace, I love teaching. I'm a surg tech, now a senior in nursing school. Shout out to you, Ashley. I've been a surg tech for 13 years. So this was so nice of you. New nurses need help to understand. And I do this because when I was a new nurse, I didn't have this, and I wish I would have known. Trauma is going to be my specialty, and I'm currently a senior. Shout out to you. Any advice for international nurses? In what way? You got to give me a little bit more context. Man, you don't miss No one, not one giggles from me. Hey, I'm just, bro. Come on, look. Look, Trey. You come in here with the sassiness, sir, telling me that you had somebody put a camera up your butt today. I'm gonna be like, oh, well, how was that? Nice. Did you feel it? Were you asleep? Were you smiling? Like, let me stop. More asking about your NCLEX teaching classes. So in my NCLEX teaching classes, like if you buy my program, I do break down the questions and I go through the rationales and stuff like that. And I actually go more in depth into the rationales when I break down my stuff inside of my classes. You're a great teacher. You have the passion and smart. Please. Oh, absolutely, Miss Julia. You already know what's up. How long do you recommend studying before getting a BSN and taking the test, applying in April? Jenna, your BSN is your degree. Your RN is your license. So if you're talking about that in that aspect, if you're going to go, just roll right into your damn degree. Stop playing. Because, hey, the one thing that you can't get back is time. That's the one thing you can't get back. I have 2 semesters left in my RN program, and I love coming across these types of live. I'm glad that you're here. Is it Heather? I'm an LPN. What should I do? I don't know. What should you do? You didn't even ask me a question, or it wasn't even relevant. You got to ask me a question. I'm an LPN. What should I do? I don't know. Live your fucking life. But LPN student, do you think it's best to buy the study guide or course? Yeah, because it's for both LPNs and RNs. Pretty beautiful. What you laughing at? That's what I thought. I had a colonoscopy and thought about you is crazy. He needs to elaborate. Hey, so Trey is one of the homies. Trey's one of the homies. Trey's one of the homies. He's cool. I appreciate this. I currently work as a PCT in med surg, but making my way to pediatrics. Julia, let me tell you something. Hey, if you're a PCT or anybody else like PCT, LPN, MA, X-ray, RT, OT, PT, I love y'all and y'all are appreciated. Don't let these motherfuckers out here try to tell you that you're not, because you are. Thank you so much. I start my ABSN program and we're learning NCLEX. All right, Natasha. Okay. I hope I'm going to end up on labor and delivery. But my sisters work labor and delivery and feel like it might be strange. It ain't got, and first of all, you and your sister are two different people. You and your sister are two different people. So if you want to go to L&D, go. Victoria says, hey, Kev, just remember, go Army B-Nate. First of all, don't even come over here with that nonsense. I watched that game. It was actually pretty pathetic, but whatever. I'm kind of sad because the Longhorns lost too. They lost to Washington, but man, home dude, the quarterback for Washington, he showed out. It's a lot of work so far, but this is my passion. I love it. I love that. If you love it, I love it. I'm just bugging. Saw you packing the house on this. Oh, bro, Trey, I had like 1,100 people up in here at some point. Do you like simply nursing stuff, or do you think it's accurate? I think simple nursing is cool. How often do you do these live teaching? I do them every Monday, Wednesday, Friday at 5:30. I graduated in May. Shout out to you. Love loud. Hey, there you go. Archer or UWorld. That just depends on you. I personally didn't like UWorld. I think Archer's cool, but UWorld works. It's been proven to work. Archer works, has been proven to work. And ironically, if people don't believe it or not, my course has been proven to work to help people. It's a brand new course. I started it in June, so I'm still very, very much in my infancy, but we about to get better. 2024 is a new year, baby. It says, Kev, tell us one of the craziest stories as a nurse. Spill it. I don't know if I got enough time for that. Let me get through the questions and we'll see what's up. My man James is here. Shout out to James. I see you in here, bro. If y'all are ever interested in trying to do a side hustle, or if y'all are trying to figure out how to, make it out the nursing game at some point, or you want to try to do something, congruent or, side by side with your nursing game to make a little bit extra cash, my man James is the man. He's one of my mentors. He's cool. I mean, I'm better looking than him. That's because I'm younger than him, but whatever. He's cool though. Cool peoples. Got to say it out loud. If you don't want to make a difference, don't join our. Hey, for real, you have to be here's the thing. You don't only, just because you're an RN or an LPN does not mean you have to work bedside. You can make a difference somewhere else, and it does not have to be at bedside. Money is not the reason. Because let me tell you something right now, as a staff nurse, that ain't it. However, there are lucrative positions that you can get to. When's your cardiology going to be posted? Ma'am, Kate, I'm working on it. Tennessee, getting ready for a bridge, RN. Okay. My current clinical rotation is on the renal floor. Shout out to you. I used I'm guessing you mean Archer and Remar. Are you still doing the infection control stuff? I'm not doing infection control anymore. I forgot I actually did that. Honest question. How many hours should a nursing student be studying? It depends. And it depends. Like, studying for what? What's James drinking tonight? Man, I don't know, but I know I won. So I want to hear it. Is that a concept map in the background? Nope, never mind. It's my brain. Julia. That's what it is. My brain is right there. Everything. I literally stood here for about almost an hour, and everything that was in my head, I had to write it down. So you'll start to see stuff like, you notice my little logo right there. It's just I have to be able to get that out. I about threw up at the keyboard at the testing center when my NCLEX shut off yesterday. Hey, I would rather you throw up afterwards than throw up before or during. You see what I'm saying? That's called having control. What's your nursing background? I worked in a burn ICU, a medical ICU, and I floated to neuro. So I have a little over a year of ICU. I worked PACU and I worked OR. It says studying in general. So I can't. So studying in nursing school is a lot different if you're studying for NCLEX or versus if you're already a nurse trying to study for like a certification exam. It all really just depends. But when you're in school, on average, they want you studying like at least like 20 hours a week, right? So you divide that by 7 or by 5. That's like what, 4 hours a week, 4 or 5 hours a week, whatever. So it all really just depends. If you're studying for NCLEX, it all just depends on like what you got. Like I tell a lot of my students with my coaching, it could be 4 to 6 hours here. It could be this, it could be that. One thing I would tell you is that everybody needs to have a time management type of tracker. I don't care if you do it on an Excel spreadsheet or anything like that. Have it on a tracker and then audit yourself. 6 a.m. in the morning to 6 a.m. the next morning. What are you doing? If there's gaps that are in there or if there's stuff that you're doing that's stupid, take it out and put your study in there. That's what I did. I bet you if I was to audit any of y'all when it came to studying, I would tear that shit apart. I'm just letting you know. I only ask because you came to my floor and we enjoyed your company. Stop it. That's not who I think it is. Oh, yeah. That's right. Brianna. I remember you. But I'm not doing the infection control stuff anymore. I'm actually at home. Taking the NCLEX on the 12th. UWorld gave me a high chance of passing on my assessment today. Okay. Then I think you're gonna rock it. Totally not expecting a black screen after the 85th question. Anxiety is it is. But you know what the thing that's crazy is that I'd rather you have the anxiety after the fact than have the anxiety, during. You have the way to control your anxiety is to literally do that situation over and over and over. So you need to practice. Sit down, recreate the testing center. Don't be on your phone. Get rid of all your snacks, all that stuff. 7 days till NCLEX. What should I be going over? You should be going over what you're not proficient at. And then the day before your exam, you don't need to be studying anything. Treat school like a full-time job. Yep. Treat school like a full-time job, even if you have a full-time job. That's your second full-time job. Just got my LNA and I work in LTC. Should I go for my LPN or go straight for RN? Savannah, that depends on what your pockets look like. Can you afford it? There's all different types of ways. A lot of people will tell you go RN. Some people have been LPNs for 20 years and they love it and they have no thought process of wanting to go any higher, and that's okay. But it all just depends on, can you afford where you are? Maybe go be an LPN, then go work at a hospital and then work for that hospital, have the hospital pay for you to go to get your RN. There are different methods and ways that you can do that. I recently graduated. I take my NCLEX in 12 days. There's UWorld Archer Simple Nursing, this class. Which one? I don't know. It depends on you. I think Archer's cool. Simple Nursing's cool. I think they're all cool. I even have my own course, the 7-day NCLEX course, where I go over tons of content and I actually break down stuff in reviews or break down questions. You could try that as well. But all of them are good. It all just depends on you. I'm 16 in high school and I want to be a nurse, but I don't know where to start. Any advice? So is it Carson? So first of all, Carson, you're probably the youngest person in here, so welcome. I have a bad mouth, but I'm pretty sure you're 16. You have a potty mouth too. But one thing I'll tell you is, the very first thing that you want to do is tell yourself why you want to be a nurse, or tell us why you want to be a nurse. Like, what is your why? Because if it's for money, that's the wrong thing, because it's really not all that lucrative as you think about it until you find some other things that are lucrative, because it comes with time. Second thing I'll tell you is start looking at schools. See what programs your school has to bridge you into the nursing realm, if that's what you want to do. Look at the school. And by the way, it doesn't matter what school you go to, as long as your school is accredited, right? And they have a really good NCLEX score, passing rate. That's it. Like, you don't need to go to a big university just so you can come and tell me, oh my God, I went to Harvard. Don't nobody care you went to Harvard. Don't nobody care about that. Those days are over. Barbara says, but you have to learn that studying is different for nursing than it is for, it is. It very much is. It's critical thinking. Facts. Time management is key. So is being organized. I have to set time to study you have to religiously. Love Simple Nursing, Nurse Mike, Nurse Sarah, Nurse D. How did you get into teaching, Kevin? Any extra courses you needed? So I started teaching when I was active duty in the Navy. I became a Navy instructor. I had to go to a month-long class for that. And then I started teaching in 2015. And then about 6 months to a year after that, I got my certification as a master instructor. And I've been teaching ever since in the Navy. And I'm actually what they call a post-secondary instructor in the civilian side. So that's my certification for me to teach. But I mean, as a nurse, we're always teaching. We have the scope of practice and the background to do education, patient education. So why is it that I can't turn around and give that education back to somebody who's going to eventually replace me or eventually replace Miss Barbara or anybody, anything like that, right? School is life. I appreciate how real you are. Hey, look, so here's the thing. I gain nothing from lying to any of y'all. None whatsoever. Even if you don't go into my link and buy any of my shit, I don't gain anything from lying to you, because the commercials on school paint this beautiful picture of you doing X, Y, and Z. But I'm going to tell you like it is. Nursing can be shitty, but nursing can also be very rewarding. It all just depends on where you are. And the thing, like I'm going to tell you again, just because you're an RN or an LPN, I don't care, even if you're an advanced practice nurse or a DMP or you have your PhD or whatever, just because you have RN or LPN does not mean you have to work bedside. It does not. So I chew gum to help with anxiety. Okay. It says, yes, I work full time and I go to school at night. Ugh, it's rough. Hey, I work full time in the Navy. Full time in the Navy. As an instructor, y'all. As an instructor while I was in nursing school. Carson, you're welcome. You will learn so much. Yeah, you will. How did you get involved in NCLEX education? Julia, I failed my NCLEX 3 times. And so I literally at some point, I gotta find my chair. I literally at some point, whoo! Hold on. Hey, I got one of these ergonomic desks, right? It's coming down, right? So I inadvertently started coaching people. Like I started coaching people because I said to myself, I never want anybody to feel how I felt when I was studying for NCLEX. Like I never want anybody to feel like that. So what I did is I started coaching people. People reached out to me because I made a testimony on YouTube talking about how I failed my NCLEX 3 times. And so they reached out to me. Once they reached out to me, then that was all she wrote. That was all she wrote at that point. And then I just started coaching and coaching and coaching. And I've been coaching now for 3.5 years. So my first person I coached was Manasa. If you guys ever get the chance to go to my stuff, you guys will see that. And that was 3 weeks after I got my license. But remember, I had already had years of education experience, so it wasn't hard to teach. It wasn't hard to teach at all. Do you think ATI is a good source to study for NCLEX? It's what my school has us using. I think ATI is. So I don't like ATI, and I didn't like HESI. I didn't like them at all, but they're proven to work. So here's the thing, if you don't like it and if you don't feel like it's good for you, then there's all different types of sources out there for you. But it's there and it's provided by your school, so why not use it? Absolute facts, Kevin. There you go. It says my son is taking his ASVAB on Tuesday for the Navy. What can he find? Where can he find good material? Jackie, YouTube, or literally go get ASVAB for Dummies. All he needs to do is just score high enough so he can land, an enlisted job. That's it. Have you heard of Nurse Achieve? I have heard of Nurse Achieve. I actually haven't heard about them in quite some time, probably since like COVID. It says, love your positivity and honesty. Ma'am, you've been here long enough. You know what's up. You know I'm about it. You guys need to invest. Okay, thank you. You're welcome. You're welcome, Jackie. But hey, shout out to everybody. I hope I got to everybody's questions. Shout out to all 87 of y'all, or 88 of y'all in here rocking with me. If you're just new here, we went over NCLEX questions for both RNs and LPNs. I will upload my videos. They will go to YouTube, and you guys will be able to check those out there. Also, I am working on my cardiac section, and I'm actually going to start doing I'm still going to do my questions. I'm still going to do my questions here on TikTok, but I'm actually going to be doing, I'm going to be doing my own e-classes. My first e-class is going to be cardiac medications. And we were going to take care of that today, but you guys are most definitely going to hear about that on Monday for sure. You guys are definitely going to hear about that Monday, because the goal is to start doing a lot of things off of TikTok, but I'm still going to be here Monday, Wednesday, Friday, giving y'all these questions, because why not? You know what I'm saying? It says you turn lemons into lemonade. Thank you. Hey, that's how we do it. That's how we do it around here. You asked me another question too. Oh, you're doing a great job. I'm sure not passing the NCLEX gave you even more empathy. So what actually given me a lot of empathy is because when I became a surge tech, like I failed the first exam, but that was like, a long time ago. And then when I finally took the exam again, I passed, but it's just like, I understand what it's like to get to that position. And, everybody look at you like, oh, I can't, there's always some sense of judgment. But in reality, don't nobody give a fuck about me. Don't nobody care if I fail that exam. So why should I care so hard that I failed the exam? I need to see why I failed, improve upon it, and then take it again. And that's exactly what I did. So once I became an instructor, a surge tech instructor, I had even more empathy. I was very, very hard on my students, but I was hard on them for a good reason. Like, nobody fucked with my students. Just like as a preceptor in the hospital, don't fuck with my student. Don't do that. I don't care if you've been a nurse for 10 years. You're not going to come over here and be rude because I'm going to check you. And that's another reason I've had problems with people is because I check them. I'm not your husband and I'm not your son. So don't talk to me like you're crazy. You know what I'm saying? So, and a lot of people like, I don't got no problem checking you. The Navy in me comes out a lot. Trust me, I don't got no problem checking you. Jackie says, I really do. You really do explain it one-on-one. Thank you for being a blessing. Absolutely. This is what, like I said, this is what I like to do. And that's what's needed. Yes, I taught clinicals for many years. You don't mess. I'm telling you, like, I'll mess with my students. You don't mess with my fucking students. Sorry. Don't do it. And I mean that. And I'm just like, no, like, especially if they're on, I think at one time in the OR, I had 2 nursing students with me and 2 surge tech students with me. And so people were just like, hey, I was like, hey, we got to make this happen. And they were cool. Like they wanted to learn. And now they were just like, oh, I think like the nursing students were just like, oh, I think I want to go OR. I was like, hey, the preceptor can make or break, which is why I enjoy teaching. So I went from being a surge tech instructor to being a pre-hospital trauma life support instructor, tactical combat casualty care, ABLS, TNCC, like all of those different ones. And I enjoyed it a lot. And so I tailored that into nursing because I never want anybody to feel how I felt. But I can't help everybody, but I can help as many people as that, that they'll, I can help you if you allow me to. Right. Exactly. Students are already stressing us. Just leave them the F. I agree. Like they're coming there. They're already scared. So why would you want to be a complete asshole to them? You know what I mean? It says OR position lined up for after my NCLEX. I know that's right. Hey, I like the OR. And I don't care. And here's the thing. And I know Miss Barbara and maybe Julia, you may say something different. But no part of me cares about people telling me about losing my nursing skill. They're like, you're going to lose your nursing skills if you go to PACU or if you go to the OR or who the fuck cares? It's not you. And it's not like I can't ever go get a job and go work somewhere else. It's like riding a bike. Nope, it's like riding a bike. Exactly, Julia. That's the shit I'm talking about. That people are just like, oh, you're don't go there. Everybody needs to go to med surg so you can. No, get out of my face. Get out of my face. I literally don't care. I'll learn. That's exactly what I'm talking about. And you know what's crazy? Guess what? I'm telling you right now, depending on where you go, you'll be able to apply those nursing skills. In the OR that I worked in, you can still do IVs. You do all that stuff. Exactly. You got to do you. Yeah, because guess what? Julia, you already know. Miss Barbara, y'all, she already knows what the deal is. It's because guess what? This profession can chew you up and spit you the fuck out. You see what I'm saying? So while you're still trying to do you and while you're still trying to take care of patients, you still got to do you. Zero desire to work adult med surg, will if I have to, but prefer peds. Okay, and that's cool. And that's okay. Because guess what? There are plenty of jobs to go around because nursing has always been in a shortage since, the beginning of time. And then COVID actually fucking you might as well just forget that. Put us behind another 5 to 10 years of trying to do whatever. You know what I mean? So just be aware that you can go wherever you want. Now, on that same caveat, you can't go wherever you want because a lot of those places will tell you need to have experience. Like you can't just go be a flight nurse. You see what I'm saying? You had solid 3 to 5 years as critical care, mostly ICU. Unless you know somebody that knows somebody, and then that's a totally different story. You know what I mean? Same thing with labor and delivery. So that all just depends. So, but anyways, that was a really good question. Shout out to all 72 you guys in here rocking with me. Hey, if you guys have any questions, make sure you guys drop them in there. I'm probably going to hang out here for probably about another half an hour, but we'll see. We'll see. I'll hang out till about 7:30. But if the questions start dimming away and you guys aren't as active, then, your boy will get off and go work on his other stuff. I was OB, then switched to ER. I have taught clinicals for 7 years. You got to do facts. You do. And I heard somebody tell me they were just like, oh my God, you're just a baby. And I was like, yeah, I may be a baby. Like, it doesn't take you long to get the gist of nursing. It really doesn't. After your first year, once you literally get over the imposter syndrome, it's a little bit smoother, But like I said, I've been a nurse for 3.5 years. And so to this point, when somebody calls me a baby, I was like, yeah, I may be a little bit younger in the profession, but I'm not young to a professional world, And so it's just like I bring all this military experience on top of leadership, on top of everything else. Like, you can bring it in there. So I realized, like, real quick are the things that I was not cool with. And so you got to be able to voice that as well. It says, getting into neuro ICU for my first job in February. What's the best advice or best ICU advice you have? Sydney, be a sponge. Ask tons of questions. If you're uncomfortable with something, open your mouth and tell them. You are your biggest advocate. You are your biggest advocate. Okay? Because trust me, hospitals will put you in situations that you will not be comfortable with. All right? But you will go through that imposter syndrome where you feel like you don't belong. Every single nurse will go through it. Every single nurse will go through it. Okay? So, but definitely be a sponge. Ask tons of questions. Be aware of your surroundings, because I'm not even going to lie to you. Y'all, and I say y'all, and by y'all, I mean 89% of women, y'all are terrible to each other. So watch out for the cliques. Watch out for the mean girl effects. Watch out for all of that, because I'm telling you, it'll create a very toxic environment and will draw down morale to where the point you won't even want to work there. So be aware of those things. I'm telling you right now, because other people won't tell you that. People won't tell you that. Chloe, what was your question? Hold on, let me see. I saw. Chloe, I take my NCLEX on Friday, super nervous. That's okay. That's okay if you're nervous. It says, amen to that. Got to stand your ground for yourself and your life. Let me tell you something right now. You ever heard of Raynaud Vaught? If you guys haven't seen her story, she was on a podcast. I think it was with Nurse Erica. I think it's called Nurses Uncorked. That shit is wild. That it is wild. So of course you need to take care of yourself and your license, because I'm telling you right now, somebody does not give a shit about you and your license. And they'll try to put you in situations because that's what they feel needs to be done. No. Nope. Take care of you. Facts. I graduate. Is it cosplay? What? Or coplay? Years ago, took the NCLEX 8 times. Cannot pass. I just was scrolling good. Lorna, what do you mean? Like, I need for you to give me a little bit more context. It says, in an interview, the best question to ask a manager, what is the culture unit? Facts. Sure is. Criminal charges for the nurse, but nothing for the system. Facts, because Vanderbilt really just swept that shit under the rug, didn't they, Julia? I'm trying to tell you. And she's trying to get her license back. And granted, she made a terrible mistake. She admitted to it. She doesn't deserve to have a license. Because guess what? If it was you or me, that's it. That's it for us. That's it. Do you suggest getting private insurance once you get your license, or use the hospital? No. In a hospital, you don't need private insurance, because it's already insured by the hospital. I could be wrong. I didn't have private insurance. Now, if you become a travel nurse, that's a different story. But maybe Julia can expand upon that. What do you think, Julia, about the private insurance? I'm not savvy at that area at all. So if anybody that's in the chat could, expand upon that. Expand upon that. Oh, Julia says, get it. There you go. I didn't have it, but if Julia's telling you to get it, the hospital will protect. Yeah, they will. Hey, so that's another thing too. HR is not for you. And by not for you, HR is in best interest of the hospital and the system, not for you, you little miss or Mr. Nurse. Trust me when I tell you that, okay? But shout out to all 60 of you guys in here rocking with me. We did NCLEX questions. Now we're essentially doing an Ask Me Anything. Shameless plug. I've been a nurse for 3.5 years. It took me 4 times to finally conquer my NCLEX. And with that, I decided I wanted to create an NCLEX course. And if anybody's interested, and if you know anybody that's interested, check it out. That link is in my bio, the 7-day NCLEX course. Once you get it forever, and you get all the updates. Also, if you're one of those people who has been unsuccessful at the NCLEX, or you need help studying, or you are scared, or you're nervous and you're looking for one-on-one guidance, I also do that as well. And you can check that out. That link is also in my bio. So it's in my best interest to get private insurance to protect myself. Yes, Sydney. Yes. That is what we are saying. Well, that is what Julia is saying, and that is what I am co-signing. Started off psych. Would med-surg be best to get back to medical? Brian, I don't know what you mean. What do you mean you started off psych? You got to give me a little bit more context. But shout out to everybody in here rocking with me. Hey, give me the 50,000 likes. What other questions do you guys have? Like I said, I failed my NCLEX 3 times, y'all. 3. 1, 2, 3. 3 times. And nobody cares. I hear there's so many people that come in here and that want to tell me their opinion about other people and their journey, how they failed. I would have never failed, bro. I didn't fucking ask you. And this isn't about you. Everybody always wants to make it about them. It's about me and my journey, my struggles. It's about you, your journey, your struggles. You tell your story to give other people hope, to give other people the thought process to want to persevere. You know what I'm saying? Not about you, not about them. All right. So when you study for your NCLEX, realize it's about you. Don't listen to other people about whatever. Don't listen to them and their negativity. Don't do it. It says, I'm not a legal expert, though, so it's up to you. Just do your research. I would agree. But there's tons of nurses that are out there that do have nurse insurance. And then you also can, if you work in one of those states that have a union, you can look into asking the union, what is the best insurance, or if the union, has, representatives for that, so on and so forth. I have seen so many people that are great nurses that struggle to pass the. Exactly. Julia, I bet if we were to work in the ER together, right? First of all, I'm a fucking hoot. You know what I'm saying? So I'm out here. Look, we already know controlled chaos in the ER, right? But you would have never known I failed the NCLEX until I told you. Just like when I was in the ER or when I was in the OR and I was telling one of the students what to use to pass the NCLEX. And I was just like, yeah, bro, I failed the NCLEX 4 times. 4 nurses that I work with looked at me and they're like, are you serious? I was like, yeah, I failed it 3 times and I passed it on the 4th. And they're just like, seriously? And I was like, yeah. And then we're just like, I never would have guessed that. And I turned and I looked at them. I was like, you see what I'm talking about? No one, you're nervous about that exam. Nobody fucking cares and nobody's going to know unless you openly tell them. I tell people all the time that I failed that exam. I tell them all the time because guess who's not going to ask me that? The patient that's on this damn bed or the patient that, for my case in the OR, on this damn table. You see what I'm saying? So let me see what you said. Nimco says, I start class in 2 days and I'm scared to get into a nursing program. Wait, what? How do you start class in 2 days and you're scared? I'm confused on what you're saying. He started off working psych, but should he get into med-surg to go back to medical? I mean, yeah, if you're looking to like try to get your feet wet and try to, brush back up and get your nursing skills back, yeah, why not? Was late today. Hey, Nana, you already know what the deal is. It says, I'm in North Carolina. I wish there was union stuff, but there is not as far as I'm aware. So, yeah. So, Sydney, I would definitely look into nursing insurance for sure. Exactly. That's what I'm saying, Julia. We'd be cool up in there. You know what I'm saying? I went to school with honor grads and first attempt passers who I wouldn't trust to give me talent facts. Exactly. I literally saw somebody who passed the NCLEX the first time and he didn't know okay, long story short, he put in the chart, he put the letter H and then the number 4. And then we were like, what the hell is H for? So we had to call him and be like, hey, bro, what is H for? Because we're looking at your notes. And he was just like, H4, H in the Roman numeral 4. And I'm like, H in the Roman numeral 4? And then he was just like, yeah, H4. I just shortened it. And I'm like, bro, do you fucking mean HIV? And he's just like, yeah. And I was just like, oh, ain't no way. Ain't no way, boy. Ain't no way. So trust me. You going to school, that's just part of it. But you got to be kinesthetic. You got to know the hands-on. And apparently my man he didn't get the memo because he put H4, literally H4. You know what I'm saying? Test taking skills mean nothing. You are a great nurse. Facts. Pre-nursing. Agreed. Oh my God, right? It says dog. I'm trying to tell you. Oh, he's making his own stuff up. It's crazy. Listen. I mean, I've seen some people say, repeat back what the patients have said, and they put them in quotes, which to me is the funniest thing I've ever seen. But for my man who's been a nurse for like a good amount of years, for him to put H4, I really think that he was just being, okay, like, I just don't get it, bro. Like, are you serious? So, and you got to realize, y'all, if you're a new nurse, that nursing note is a legal document. You chart like you're going to court tomorrow. Okay. So you got to be careful. You got to be careful about what you're doing. I love using quotes from a patient. It says, but H4 makes no sense. Yeah. And it'd be different if the patient said H4, but you're a whole nurse. So it says test taking is my struggle, but I passed my first semester. Okay, one step at a time, DH. I think the hardest part is figuring out what studying works. So I'll give you a gem. Now, first of all, you're trying to figure out what study works. But first of all, let's start with you. What type of learner are you? What type of learner are you? Is like, how do you absorb, not only absorb, but retain the information, right? So are you a auditory? Like, are you a podcast listener? Are you an audiobook listener? Are you the type of person that, you drive 45 minutes and you get all this knowledge and you listen to it over and over and you hear it? You know what I'm saying? Are you the type that sits on the toilet and just listens to stuff? Do you listen to music while you're in the shower or whatever? Are you auditory? How is that how you absorb and retain the information? Are you a read write? Are you the type of person that looks at a PowerPoint, looks in the book, or are you writing it down? Are you a visual? Like, do you like, like if I showed you a video of how the heart pumps, or if I showed you what the heart looks like for different, arrhythmias, like freaking AFib or AFlutter, like, would you be able to recognize that? Like, are you a combination of all of them? Are you what? Auditory, visual, kinesthetic, read, write? Are you a combination of those? That once you understand what type of learner that you are, you will understand what type of studying method will work for you. Or use visual or make concept maps. Julia, I was never a big concept. Well, I guess that's kind of considered a concept map, right? But I'm definitely a visual person, and I'm definitely visual and auditory, and most definitely kinesthetic. It says, yes, they can come back and drag you to court at 10 years. Yeah, 10 years. H4 though? Yes. Wow. I always watch one of those videos that has a tons of pictures and visuals first, then do my reading. Okay. And Sydney, that's how you absorb and retain, because I bet you if I was to be like, hey, can you draw out what the heart looks like the easiest way possible and tell me what your visual representation is of atrial fibrillation? And you're just like, wow, Kevin, that was a lot of words. But if you could do it, you could. Always allows me to think of the pictures while I'm reading. Exactly. What's up, Cammie? What up? How are you? So that's how you have to think. Like, what type of learner are you? Picmonic always worked well for me, but everyone needs to figure out their best learning style. Exactly. So that's why when I have people come in here to me and they're just like, hey, what's better? UWorld, Archer, Kaplan, Hurst, NCLEX High Yield, Remar, Mark Klimick, Kevin Gibson, blah, 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 blah. And I'm like, it all just depends on you. I've had people use my course, and my course has been up for 7 months. And they're just like, bro, I love your videos. I love your content. I passed in 85 questions. Love it. I have other people that come to me and they're just like, hey, I use Archer and it worked. I coach people with Archer. I coach people with UWorld. I coach people on Kaplan, on Hurst, on whatever the hell you have. And it all depends on you. Listen, y'all, I've spent a total of $3,000 before I got my license. So I spent $3,000 so you don't have to. Another reason why I created my course, right? But why I say that is because I had to figure out, and unfortunately, I wouldn't even consider it money not well spent, because I had to spend and invest that money to figure out what I didn't do well, or where I was falling, or what had a deficit in. And you have to find that out for yourself as well. Now, you have all these other ones that are good, like Simple Nursing, cool. Remar, cool. Archer, cool. UWorld, cool. 7-day NCLEX course, cool. Like, all those are cool, but you need to figure out what is best for you. How do you sign up for one? How do you sign up for one-on-ones if you offer them with whatever I'm already using? So if you're looking for like NCLEX, Sydney, you can go to the link in my bio, and it's in a link tree. You click the link tree, it'll take you to everything that's listed there. And then you click on the one that says NCLEX coaching. I also do another one, private one-on-ones, but that's also for NCLEX, but they're only like 1 sessions. The NCLEX coaching is like a big package deal. And so the thing about it is just like with all of these type of with all of these, what's the word I'm looking for? These reviews that are out there, they all relatively have the same concept. Remember, you know my date. Remember, you know my date. What do you mean, Cammy? I forgot. Was it January 13th? Something like that? I can't remember. All right. But yes, Sydney. So that's how you would have to do it. As a matter of fact, I am updating that right now. It's January 13th, right? I can't even believe I remember that. That's right around the corner. That's like what, next week? Hey, girl. Hey, you already know the deal. So, Sydney, you are very welcome. You're nervous. That's cool. Be nervous. You already know what I'm about to say. You already know my two things that I'm about to say. Hey, for the 52 people that are in here that are telling, you guys start telling me that you're nervous. Here's something I'm going to give you. If you're scared, go to church. Nobody ever did anything great without being scared in order for them to progress in life. That's number one. Number two, when you're scared and you have to go through it, I call it getting off the beach. And I'm pretty sure everybody's always heard this story, and I always say it. During World War II, they had to storm the beaches of Normandy, and they had to go through France in order to, stop Germany from doing their thing. At certain parts of those beaches, they were mowing people down. So it's either one or two things is going to happen. You're going to be scared and you're going to stay there and you're going to die. Or you're going to be scared and you're going to move forward, because that was your only way of surviving. So in order for you to progress, what are you going to do? Are you going to stay there, or are you going to stay there and be scared and not progress, not get your license and waste all that time to get into nursing school and graduate? Or are you going to be scared and go forward? You tell me. You tell me what I'm going to tell you right now, because that's what I did. I got to my third test failure and I'm just like, bro, I don't want to do this anymore. And then it took somebody that's currently in my position right now as a mentor to check me. You see what I'm saying? So sometimes that's what y'all need. You need to check. You need checked. You see what I'm saying? It says, okay, thank you. I'm nervous. What would you say to someone who is just about to start nursing school? Julia, I got you. Hold on one second. Damn, Kev, if you put it like that, then I'll get up and get off the beach. Yeah, get off the beach. Get off of your beach. So true. Church saved me through nursing school and calmed me down through it all. Look at that. If you're scared, go to church. Go pray, or go pray to your higher being. But however, doesn't matter how much you pray, you still got to put the work in. You have to put the work in. And Kemi, you already know the deal. You know what's up. You know what I'm about. We all have our own beaches when we hit stuff that we struggle on. Look, I struggle on things every day. Every day on trying to do better. Honestly, do better for y'all. Do better for, my other students, and to do better, for a family, be a better father and a better, significant other, like doing all those things. Like, you can't get better unless you get through those struggles. It says, got to do your part. Praying can only take you so far. Exactly. I posted up something not too long ago where it says, there was just essentially saying that, you need to put in the work. God already told you what to do. So, hey, God already told, if that's your angle of your belief system, they already told you what to do. You already know what you need to do. It's called putting in the fucking work. Faith without work is dead. Facts. If you guys are finding value, give me 50,000 likes. Hey, I'm only 1,000 away, so I'm just saying. You know what I'm saying? It says, you're welcome. At Cammy, you made it this far. You look back when you first started. Exactly. Appreciate all the effort you do to get us to those. Hey, that's what I'm saying. I enjoy wanting to get you guys to the other side, because you know what's going to happen at some point. We'll say it's 5-10 years down the line. What if I'm on TV? You're gonna be like, oh my God, I know him. I saw him on TikTok, or he coached me, or whatever. I bought his course, something like that. So now back to your question. I think it was Julia's question. What would you say to someone who is just about to start nursing school? First thing I would tell them, Julia, is that they really need to if they have a family, they need to talk to their family for sure. As in hey, you need to know what I'm about to embark on, and we're all about to be a part of this. That's the second thing, or the first thing. Second thing that can go hand in hand with that is time management, because your first semester of nursing school is going to humble you. It is going to humble you so much, because it's just going to be so much information that they're going to dump on you. Your first 2 semesters of nursing school are essentially, can you fucking handle it? Like fundamentals is the weed out. But med surg, which is usually like your second semester, second quarter or whatever, that is the nursing, the student nurse killer. Trust me. First test being over 16 chapters, stop it. That's going to determine whether you want to be there or not. You know what I mean? So I'm just saying. It says, yes, we know you. Hey, that's what I'm saying, Jackie. And you'd be like, hey, y'all, look, Kev's on the bus. Hey, what up? Kev's on the bus. Hey, not today, y'all. I'm sorry. Hey, I love me some Kevin Hart. That's my dude. But let's see. It says my fingers hurt. You have 50K yet? Yeah, we have 50.1K. So Cammy, I appreciate you. It says yes, it is. It says, Kevin, when I say you are preaching right now, I sat my family down and had a family. That's what I'm saying. You have to do that. You have to do that. If you don't, to me, if you start embarking on something that you know is going to take away a ton of your time, your mental capacity, your emotions, it's going to stress you out. If you don't talk to your family or anybody that's important to you or you consider important, if you don't talk to them about it, that's irresponsible. That's an irresponsible thing that you don't, that, because you got to think they're on, even though they're on the journey along with you. However, they're indirectly affected because you're the one who's directly affected because you're the one who's doing it, right? And so acknowledged via Firehose facts. 50K, I see it, Sydney. Whoop, whoop. It says taking my boards next month. That's what I'm talking about, Ashley. Hey, so you're taking your boards like, I don't know what you're doing this for. Like, it's not a surprise. Anybody that comes here that's a nurse, I know you're going to be taking those boards or you've already been a nurse and you've already taken the boards. So the good thing, Ashley, is that you're around people who are going and who have been through the struggles that you are currently embarking on, so to speak. Okay, so we all get it. But hey, look, y'all asking me some really good questions. Today's Friday and I'm feeling real preachy, preachy. So I appreciate everybody being here. If you guys are new here, we're doing NCLEX talk, nursing talk. I did NCLEX questions earlier. We went through 30 of them. It takes me about an hour-ish to get through them. So I appreciate everybody being here for that. So it said, did you just start? No, Jesus. Jesus is king. You missed it. I started at 5:30 Central Standard Time. Come on. So I usually do NCLEX questions right at the beginning, 5:30 Central Standard Time. We already went through all those questions, so the questions are done. However, don't fret. Don't fret about it. You can go over to my YouTube channel, which is linked in my bio, and all of my TikToks that I do here, they go up there. So if you miss questions, you can go up there and still get you some questions. I cried the late night coffees, the bill sacrifices, Christmas, family, and trip. Look, Jackie, let me tell you something right now. There was one time when I was in nursing school and my family, they wanted to go to Las Vegas, and I went to Las Vegas. And do you know what I did the whole time? Because it was in the middle of my nursing school, because my nursing school was online. I stayed in the hotel room. I barely left the hotel room for the 3 or 4 days that I was there because I had assignments that needed to be done and blah, blah, blah. So I just couldn't do it. It says, how do you manage the work-life balance? I leave work at home. I leave work at home. What kind of sense does that make? I leave work at work. I'm telling you right now, I leave work at work. That's number one. Number two, if you're dealing with anything mental, because nursing can destroy you emotionally and mentally because you're dealing with other people at, sometimes their worst. Another thing I would tell you is to seek professional help. And there's nothing wrong with that. Look, I'll tell you flat out, I've been going to therapy for over 3 years right now. Right? Had a lot of stuff happen to me, like before nursing. I've been on 2 deployments. I went through a divorce. I went through all these things. So I've been going to therapy religiously for 3 years, right? On top of this shit that we call nursing, that we deal with. That's part of your life, and that's part of what you need to balance. I think we could all agree with that. There's nothing wrong with you talking to somebody. So first of all, leave work at work. Leave it at work. Because trust me when I tell you, they don't give a shit about you. Like when they start calling you and they're just like, hey, we're down on the unit, blah, 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 blah. Now, there's some give and take, and I understand that. And I've been one of those people that have jumped on calls but after a while, let me tell you something. If I work 4 or 5 days in a row and you keep calling me, bro, don't you fucking call me. Leave work at work. I need my time for me to re-energize, decompress, sleep. You know what I mean? So that's what I would, and do the things that you like. Like if you like to hike, if you like to walk, you like to exercise, go do that. Go do those things. Don't come home and don't be, sit on the couch and get fat. Sorry, you're going to get fat, eat and wallow in your fucking sorrows. Like get up and go do the things that you like to do. That's how you keep a healthy work-life balance. First of all, you keep work at fucking work. You leave it there. Leave it there. All right. Don't bring all that nonsense home with you, because then if you bring work home with you and if you have a family, they're going to feed off of that energy. And then you could you don't want it. You don't want it. OK, don't do it to yourself. What state are you in now? I live in Texas. The best advice I can give: find some friends in your cohort and study together. So that's one thing I could say. You want to get into a small group, no more than 4 people. If you guys ever get the chance, go to my Instagram. It's at the Boot Nurse. You'll see my gorgeous face there, right? And if you scroll all the way down to 2018, you'll see that I'm in a picture with 3 other women. Those women right there, great friends. We're still friends to this day. We talk every so often. But if it wasn't for them, we nursing school, I wouldn't be here sitting here talking to you. You know what I'm saying? So that's definitely something you could do. I have a therapist. They are great. But with the off hours and kiddos, it's hard to balance. So honestly, Julia, you could definitely freaking put yourself on a schedule too. Literally. In my kitchen or living room area, we have a big calendar, kind of like this dry erase board right here. And we write stuff on there. Every Saturday is family day of some sort. We do something. Every Saturday. Doesn't matter. I'm not doing TikTok. I'm not doing anything with the course or any business, any client, any students, no, nothing. So put it on a damn calendar. Mental health is definitely real. Kevin didn't realize that until I took exactly. It is huge. It is so important. Taking it the 3rd time got test anxiety real bad. So you're taking your NCLEX for the 3rd time. Well, actually, of course, if you're new here, and if I didn't say that already, I took my NCLEX 3 times. I'm sorry, I took it 4 times, failed it 3 times, passed on the 4th. I've coached people, so you're going to have the test anxiety. The one thing I'll tell you for test anxiety is you need to recreate the testing center. If you recreate the testing center to try to mirror it as much as possible, right? And then you go in and you do your quizzes. I don't give a fuck where you get them from. I don't care if they're from Archer, Kaplan, UWorld, wherever. Treat your office, your bedroom, your wherever, where it's quiet. Recreate that. And once you recreate it, you'll notice how when you get into a rhythm, the test anxiety will go away because you're already used to what it's going to look like. Does that make sense? If that makes sense, let me know. And if that makes sense to all the rest of y'all, smash that like button. Give me some love, okay? You know what I'm saying? Y'all got to do that for me. So anyways, hey, I got about a couple more minutes. What other questions do you guys have? I want everybody, of course, to have a really good and safe weekend. First week of 2024 is in the books, ladies and gentlemen. First work week for most of us, right? Well, unless you're doing, your 12 ons or whatever. So it says, yes, thank you, Kevin. Okay. All right, Ashley, you good. Definitely do that in my living room. Exactly. Jackie, you have to be able to do that. Like, what's crazy? I'm not super productive until like everybody's asleep in my house. So if I need to recreate a testing center, guess what? I wouldn't be on this phone, no snacks, no nothing. All that stuff would be out. My phone would be on Zen mode or whatever. And then it is here. This cubicle I've created for myself right here is it for the next hour and a half, 2 hours, however long it takes for me to get through 85 to 150 questions. That's it. I don't hear nothing going on out here. Just like it's quiet in a testing center. So if you prepared for what the testing center looks like, you're going to be, listen, I got to question 40. And by the time I got to question 40, it was when I realized I was sitting like this. Because when I was practicing how I was studying, this is how I ended up every single time. And when I was at question 40, I was like, what the hell? All right, cool. And I just kept doing it. Next thing you know, the test was taking longer to get to the next question. I was like, damn, I hope it didn't freeze on me because I really don't want to take this again. And then it said, congratulations, you're finished with the test. I'm like, oh my God. Right? So I understand what that feels like. But, I knew when I took that exam the 4th time, I knew that I passed. Like, I never walked out of an exam so confident. I never walked into an exam ready for it. I'm telling you. You can kill that exam. You can conquer it. For sure, you can conquer it. It says, yes, even the dog mess with me. So I got to do that. And that's what I'm saying. You got to put, hey, you got to lock them up. Not really, but they can't be where you at. You know what I'm saying? So, but all right, ladies and gentlemen, that looks like, hey, we're coming on 7:30 right now. Like I said, I appreciate everybody that came through. I appreciate everybody that asked all their questions. I hope I have good news by the next live on Monday. Don't tell me you hope. Say, I'm going to have good news. Speak it into existence and it shall be so. Thank you again and have a good weekend. You too. You have a good weekend. But of course, last unshameless plug, because I'm never shameful for telling anybody about what I have going on. Hey, if you're looking for a freebie or an ebook, you guys can check those out. Those are in my link. That's linked in my bio. 7-day NCLEX course, $97. You get it forever. Good night, Grace. I ain't seen you at all. And then here you go. You get it forever. God, ancestors willing, right? So guys, go over there. You guys can check that out as well. If you are somebody who is struggling to study for the NCLEX, or you're taking it multiple times, like somebody like Ashley, or like Miss Stacy, who passed it on her 12th attempt, come holler at me. Come check me out. You can check me out. Go to the link in my bio, NCLEX coaching. Or if you're looking for something one-on-one to where I can talk to you for an hour, at least an hour. Like if you want to talk about ATI, or if you want to talk about HESI, the entrance HESI exam, all that good stuff, you can check that out with my private tutoring, which I do as well. But, and of course, go follow me on YouTube. Go follow me on the gram. Go follow me on, and of course, follow me here on TikTok. Don't be greedy. Come over here and show me some love. Just don't come over to my shit and start trolling, because I'm going to troll that ass back. Because y'all know that's like my favorite pastime. It's therapeutic for me. So, but yeah, last shameless plug. But hey, of course, have a good weekend. Be safe. I want to see everybody here on Monday. You know what I'm saying? I want to see everybody here on Monday. So you guys already know what the deal is. Hey, be ready for next week, because next week I'm coming with the fire. Y'all be ready for it. But until then, ladies and gentlemen, I will catch everybody on Monday, same time, same channel, and we're going to knock out some NCLEX questions, because, hey, we always put in that work so we can get that license, and so we can go out there and make a difference, not just for our patients, but just for ourselves. But bye.